Welcome to watch this video. This video will introduce about general surgeon. A general surgeon is a medical specialist trained to diagnose and treat a wide range of conditions through surgical intervention. They handle everything from abdominal disease to trauma care, and their work often saves lives. Now let's look at the anatomy related to general surgeon. A general surgeon must have a deep understanding of human body. First, we look at the thoracic cavity, which is the space enclosed by the rib cage, sternum, thoracic vertebrae, and diaphragm. It houses vital organs like heart within the pericardium, lung within pleural sac, and major blood vessels such as aorta, superior and inferior vena cava, trachea, bronchi, esophagus, and thymus. Thoracic cavity can divide into mediastinum and pleural cavity. Mediastinum is the central compartment of heart, vessel, trachea, and esophagus, while pleural cavity is where the lung on either side. Next, we look at breast anatomy. So breast is located in the anterior thoracic wall, overlying the pectoralis major muscle. Breast composed of glandular tissue, which produce milk, fatty tissue, which determines size and shape, Cooper's ligament, which provides support, and breast contain the nipple and areola with duct for milk secretion. Next, we look at the skin and soft tissue. Skin has three layers: epidermis, dermis, and hypodermis. Epidermis is the outer layer which acts as a protective barrier. Dermis is the layer which contains blood vessel, nerve, gland, and hair follicle. And the hypodermis, which also known as the subcutaneous tissue, is the fatty layer connecting skin to underlying structure. So for the soft tissue, it includes muscle, fascia, ligaments, and fat that support and connect the body structure. Then we look at the endocrine gland. Endocrine glands are ductless glands that secrete hormones directly into the bloodstream. So here are a few types of major glands, which is the pituitary gland, which master gland controlling others, thyroid and parathyroid gland, which regulate the metabolism and calcium, adrenal gland, which release cortisol and adrenaline, pancreas, which is the insulin and glucagon for the glucose regulation. So the function for the endocrine gland is maintain homeostasis, metabolism, growth, and reproduction. Now we look at the abdomen. The abdominal cavity lies between the thoracic diaphragm and pelvic cavity. It contains digestive organs such as stomach, intestine, liver, pancreas, and spleen, and also the urogenital structure like kidney and ureter. Abdomen can divide into 4 quadrants, which is right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. So abdomen bounded by anterior, which is the abdominal wall muscle. Then posterior is the vertebral column and muscle. The superior is the diaphragm, and inferior is the pelvic inlet. So today, this video will focus on the appendix, a small finger-like structure attached to the large intestine. While its exact function remains unclear, when inflamed, it leads to a medical emergency called appendicitis. Understanding anatomy is crucial, but surgeons must also navigate the biochemical process that occur during conditions like appendicitis. Biochemical processes like wound healing and electrolyte balance are integral to surgical care. For the wound healing, after surgery, the body undergoes a healing process involving coagulation, inflammation, and tissue remodeling. Surgeons optimize this process by ensuring proper wound care. Then for the electrolyte balance, it maintains stable level of electrolyte like sodium and potassium during surgery to prevent complication. So the acid-base balance is also important because during long surgery, surgeons monitor blood pH to prevent acidosis, which can damage organ. So for the appendicitis, there are two key processes stand out. First is inflammation. When the appendix becomes blocked, bacteria multiply, leading to swelling and infection. This triggers an immune response with cytokine and white blood cells flooding the area. The second one is sepsis. If untreated, the infected appendix may rupture, causing bacteria to spread into the abdominal cavity. This can lead to the life-threatening systemic infection. So surgeons act quickly to remove the infected appendix, stopping this harmful process before they escalate. Biochemical processes are interconnected with the body physiology, which must be carefully managed during surgery. Physiology plays a critical role in surgery. So to manage the cardiovascular system, the general surgeon monitoring stability of blood pressure to prevent complications like blood clot or organ failure. Next is the respiratory system. During surgery, it needs to ensure proper oxygen level under sedation. So anesthesia can affect breathing. So surgeons work closely with anesthetists to ensure proper oxygen levels and prevent complications. So the last one for the physiology is the gastrointestinal motility. Surgeons often treat conditions like bowel obstructions. Understanding how the intestine moves is essential for restoring their function after surgery. It's also important for understanding conditions like appendicitis. When the appendix is inflamed, it can block normal intestinal flow, leading to abdominal pain and digestive issues. Surgeons must consider how removing the appendix might impact the gastrointestinal system and ensure smooth recovery. With this understanding of anatomy, biochemistry, and physiology, let's discuss how surgeons address appendicitis. Before that, let's look at some common diseases treated by general surgeon. General surgeons treat a wide range of conditions, including breast cancer. Surgeons remove tumor through procedures like lumpectomies or mastectomies. The next condition is gallstone. There are hardened deposits in the gallbladder that cause severe pain and infection. Surgeons perform a cholecystectomy, which is the removal of gallbladder. So the next condition is hernias. General surgeons repair hernias where an organ pushed through weakened tissue, such as in the abdomen. Then the next one is the trauma case. For injury causing internal bleeding, surgeons perform life-saving operation to stop the bleeding and repair damaged organ. So now is the appendicitis, which is the main focus of our video today. Appendicitis is one of the most common emergency requiring general surgery. It begins with abdominal pain, nausea, and fever. If untreated, the appendix may rupture, spreading infection throughout the abdomen. The standard treatment is an appendectomy, the surgical removal of appendix. There are two approaches. First is the open appendectomy, which a large incision is made to access the appendix directly. The second one is the laparoscopic appendectomy, which a minimally invasive technique using small incisions and a camera to remove the appendix. This method allows faster recovery and less scarring. So to illustrate, let me share a real-world case. A 20-year-old male presented with severe pain in the lower right abdomen, nausea and fever. After a clinical examination and imaging, he was diagnosed with acute appendicitis. A laparoscopic appendectomy was performed and the patient recovered fully within a week. So this case demonstrates the surgeon quick decision making, knowledge of anatomy, and surgical precision in managing emergencies. Lastly, let's explore the technology that support such procedure. Advancements in technology have revolutionized general surgery. For appendicitis, surgeons often rely on laparoscopic instruments, which allow surgeons to perform minimally invasive procedures, leading to quicker recovery and smaller scar. Next is the endoscopy system. So this tool help diagnose and treat conditions inside the body without the need for large incisions. Then is the ultrasonic device. It's ultrasound device. Surgeons use ultrasound to guide procedure like draining fluid or targeting tumor. Then the next instrument is Da Vinci surgical robot. This advanced robotic system enhance precision and control, especially in complex surgery. Then the last technology is the 3D printing. So 3D printing, customized surgical model, create from 3D scan, help surgeon plan complex operation. These technologies enhance accuracy and reduce patient recovery time. So before we move into the conclusion, so now I want to introduce a profession in general surgeon that give me the inspiration to involve myself in this field in the future. So the profession is Dr. Peter Ong Ming Chong, a resident doctor in general surgeon at KPJ Sabah Specialist Hospital. So he has a key influence on my aspiration to pursue a career in surgery. Dr. Ong is a skilled and compassionate general surgeon who demonstrates qualities essential to his profession. I witnessed his dedication firsthand when he successfully performed surgery on a member of my family. So Dr. Peter Ong get his MBBS degree at University of Melbourne in Australia and his specialist degree at College of Surgeons of Edinburgh in United Kingdom. So as a conclusion, general surgeons are versatile specialists combining anatomical knowledge, biochemical understanding, and advanced technology to treat a wide range of conditions. Appendicitis, one of the most common emergencies they handle, is a testament to their life-saving expertise. Through their dedication and precision, general surgeons not only save lives but also pave the way for better surgical outcome and patient care. Thank you.